Assalamu alaikum and hello. Today I'm going to explain the general principles of periodontal surgery. This is the outline of what is included to understand the general principles. These are 14 points, but I'm trying to divide the videos into several into several topics so you can understand and have more concentration to understand each video. So let's begin. First, I'm going to begin with the goal. What are the goals of periodontal surgery? It is to arrest the progression and to the progression of periodontal disease. It is to prevent the recurrence by creating an environment that the patient and dentist can maintain in a stable status. So we create a stable environment. So we attempt to produce a regeneration. We produce a regeneration of tissues that are destroyed due to diseases, and we correct aesthetic problems and we prepare the periodontium for receiving restorations. So we prepare everything so at the end the patient can get its restoration. Prepare for restoration. So now with the first, I'm with the first point done. The second point is indications. What are the indications for periodontal surgery? The first one is if you see a periodontal pocket. Okay. What does that mean? These periodontal pockets, they're resistant to treatment due to inaccessibility for subgingival instrumentation. So they're resistant to treatment. We try to do subgingival instrumentation, but they're difficult because, or in what cases are they difficult? There are three main cases where you need to do periodontal surgery rather than subgingival instrumentation. There's the first deep periodontal pockets more than 6 millimeters with bleeding on probing. Okay. And we have deep periodontal pockets also with more than 6 millimeters, but with no bleeding on probing. And if you have furcation involvement. So furcation involvement means you have loss of attachment. You have loss of interradicular bone. This can be especially seen in grade 3 and 4. We have 4 types of furcation involvement. We have the grade 1, 2, 3, and 4. In 3 and 4, you can do the periodontal surgery. Furcation type 2 can be regenerated. Okay? If the so the thing is so just to revise or to add several points, the indications of periodontal surgery is at first if we have periodontal pocket, if the accessibility is a problem. This can be A. And B, if the regeneration of periodontal apparatus is destroyed by periodontal disease, for example, as intra-bony defect. Okay. So then, this is the first type that is indicated for periodontal surgery. The second type, the second point that is indicated for surgery is abnormal gingival or bone morphology. Abnormal gingival bone morphology. So, why is it important to correct the abnormal contour? It is important to facilitate accessibility for self-performed plaque control. It corrects, the periodontal surgery corrects the abnormal gingival contour. Example, if we have gingival enlargement that interferes with the plaque control. And it corrects abnormal alveolar bone morphology, either by osteotomy or by regenerative means. So osteotomy or osteoplasty. So abnormal gingival bone morphology can be here at first, for example, gingival enlargement. If we have abnormal gingival contour, and if we have abnormal bone contour morphology, we do osteotomy or osteoplasty. Okay. This can be also called as here as resective periodontal surgery, either by removing the bone, which is called osteotomy, or by adjusting the contour, osteoplasty. The third indication is if we need aesthetic improvements to cover denuded roots or to create lost interdental papilla in case of gingival recessions, or in other words, we have to cover the exposed root, or if we want to cover the black triangle. Sometimes we see the black triangle if the interdental papilla is lost. And fourth is the pre-prosthetic one. The pre-prosthetic type. The pre-prosthetic type is we do it for preparation for restorative treatments, for restorative or prosthetic treatment, such as crown lengthening and ridge augmentation. So pre-prosthetics, such as example, crown lengthening or ridge augmentation. Fifth indication is if we have mucogingival problems. That means if we have a decreased zone of keratinized gingiva, that means we have a decreased periodontal health, which leads to recession. That means it is good that the patient has enough keratinization on the gingiva. If it has less amount of keratinization, it can lead to periodontal problems. The patient is susceptible to recession. So we have here, we can say, mucogingival problems such as narrow zone of attached gingiva, and if we have highly attached frenum. And if we have, for example, a highly attached frenum, the teeth can't be brushed, the gingiva is always inflamed, and it can lead to gingival recession due to the gingival margin pull. Okay, then sixth, we have the implants. Okay, the implants. And these implants is important for the is important if we have inadequate bone. It can be used in the technique guided bone technique, also called GBR. So just for a quick review, indications are for periodontal pocket. If we have abnormal gingival bone morphology, if we have aesthetic improvement, if we need aesthetic improvements, if we need pre-prosthetic treatments, if we have mucogingival problems, if we need implants, sometimes we have inadequate bone, so we need the guided bone technique to do the implant. Okay, so we did from the outline, we did the goals and the indications. Now we have here the classification. So I'm just zooming in here. The time of periodontal surgery, we have here the periodontal. Okay, it's too thick. We have here the periodontal surgery. We have 3 types of surgery. If we have periodontal disease, for example, we do the surgery if we want to reduce the pocket reduction surgery, or if we have the second type of surgery is periodontal plastic surgery. In case of root coverage, black triangle, as we said, inadequate zone of attached gingiva, entirely attached frenum. And the third type of surgery can be the pre-prosthetic surgery treatment. And for example, we have here the crown lengthening. Okay. So these are the 3 types of periodontal surgery. What we can do is here periodontal disease. If we need to do a pocket reduction, regeneration, if we have any abnormal morphologies, the gingiva or in the bone. If we have periodontal plastic surgeries in case of root coverage, black triangle, and so on. And if we need pre-prosthetic surgeries, such as crown lengthening, to do then the actual treatment. So then we're done with the classification. Now we're beginning with the contraindication. So what is the contraindication of periodontal surgery when it is unsuitable to do the periodontal surgery? It is unsuitable if you have, of course, uncooperative patients, where the patient motivation is obviously inadequate. If we have systemic diseases that requires patient's physician consultation, such as malignancy, blood disorders, liver disease, severe cardiovascular diseases, renal disease, uncontrolled diabetes. These are all contraindicated for periodontal surgery. And if we can use the scaling and replanning and home care. So if we can use these two, scaling and replanning and home care, these will control the diseases. So periodontal surgeries in this case contraindicated. Okay, if we have a hopeless tooth, of course, hopeless tooth is the grade 3 mobility type, where we have vertical and horizontal mobility. They're indicated for extraction then. If we have acute infection and last but not least, when the post-operative appearance will be so poor, resulting in patient distress. So it is, of course, appearance is very important. For both pseudo and true pocket presents. So we have talked here about the contraindication. I didn't write it down. I just did it orally. So most of them, you guys know it for other contraindications for other treatments.